Hello, and welcome to the module on HIPAA for the Wisconsin MPJE course. What is HIPAA? HIPAA is the Health Insurance Portability and Accountability Act of 1996, and this was to help improve the efficiencies and the effectiveness of the healthcare system in America. This helped to create national standards for electronic healthcare records, code sets, unique health identifiers, and security for all. HIPAA applies to all covered entities who are healthcare professionals, like doctors, nurses, and pharmacists, health plans, like health insurances, and the healthcare clearinghouses. This is essentially the middleman between the healthcare providers and the insurance payers. And this also covers any business associates of these covered entities who work with information classified as HIPAA. So what information is HIPAA? HIPAA can be prescription records, billing records, patient profiles, and under this there could be their names, their addresses, their phone numbers, any allergy information, health condition information, things like that. Also, counseling records for patients, and any oral communication of individually identifiable health information is all considered HIPAA. Things that are not considered HIPAA is any information that's de-identified. You do have to go through a whole process of what does de-identification mean and look like, and that can vary from state to state and practice site to practice site. So check with your local site. Employment records, education records, and this is because it falls under FERPA, which is a different protection, and records of those who have been deceased for more than 50 years. HIPAA in the pharmacy. For pharmacy, it is important to know that the biggest area of HIPAA that you'll be dealing with as a pharmacist in the pharmacy is PHI, or this protected health information. This can be anything that is either transmitted by electronic media, maintained in electronic media, transmitted or maintained in any other form or medium. It can be in any of this form. And like I mentioned, most things in the pharmacy meet this PHI definition. And more things about this in the practice. As part of the healthcare team, it is important to know what you can do and should be doing to protect your patient's privacy. One way to be doing this is to make sure that all discarded PHI is disposed of properly. And if it does have any patient identifiers or anything from that list that we just went over that is considered HIPAA, it should be thrown out in PHI disposal bins like this one. If your pharmacy has these bins in a different area, like most community pharmacies may, you can use normal bins with an opaque bag to help transport the disposal of this information from those bins in the pharmacy out to these disposal bins. Some more, in some situations you may have to return medications ready to be sold to the patient back to your stock shelves, or the patient goes home from the hospital and they no longer need those medications. Some medications get destroyed, but some you can put back. In the situations where you have to put the medication back, you should also work to de-identify the patient information on the label. Again, this will be from site to site, so make sure you just kind of work with your site and see what their practice is. But best practice is to remove the label with the patient information on it, and or just relabel the bottle with just the drug name so that you can use the medication for a different patient. And as a reminder, again, best practice is to always replace the plastic of the bottle. And then you can also use a black marker. This is also called like a China marker to help cover up the patient information as seen in this example here. So it covers up the patient's name and address, and all we are left with is the medication information on there. Lastly, in a lot of settings, PHI can be orally transmitted. This can be anything from verbal transfers between pharmacist to pharmacist, providers calling in a prescription for their patient, and then just general communication within the pharmacy or in the healthcare space about a patient. Ways to limit what others can hear in the pharmacy and in like a healthcare space is really hard to do. But in the community setting, you can allow for a separate window for counseling for new medications, asking the patient or person in front of you picking up to help give you 2 pieces of information for verification before proceeding on discussing any potential information that's considered HIPAA to confirm that they are there for that patient that you are looking at. And that's just a safety precaution for you to make sure you're not breaking HIPAA. And then who can you provide HIPAA information to? Always the patient. They can always get their own information if they request it. Kind of in a trickier situation is if a patient sends a friend or family member to the pharmacy to pick up their medications. They can send these people on their behalf without giving the pharmacy any pre-authorization for that person, as long as that person picking up can verify this patient's information when we ask for it. However, if the patient wants or needs a friend or family member to pick up paperwork for them that contains any PHI information, they must give pre-authorization and to allow us to give that paperwork to that person. And the person also must show an ID to prove they are who they say they are. And that's more for like medication records, health records, things like that. The patient can also have a legal representative who also should be pre-authorized by the patient, unless, of course, they are under the age of 18 and this is their legal guardian who is considered pre-authorized because they are a minor and they cannot give the pre-authorization. So when can you provide this information to others outside of the patient giving you the pre-authorization? You can provide HIPAA information for TPO. That's the biggest acronym I want you to remember out of this. And that's treatment, payment, and operations. Treatment is the management of care or other related services. This can be any consults you have to do for your patient, so no matter their disease state, if they're there and family member picks up their medication and you're providing it over, that consult is considered HIPAA, but you need to consult on the medication. Referrals, we probably won't do a whole lot of this in the pharmacy, but if you hear about this or see it, that's considered HIPAA. And then transfers, a big thing that we will do. This is what time then you can exchange information without the patient's pre-authorization. Payment of healthcare is the P, and that's transmitting insurance information for payment and collecting information for payment. So if you have to call over the phone and ask for a credit card number, that is HIPAA information and should be treated as such. Lastly, healthcare operations such as audits, if you have to ever report child abuse, or if there's ever disasters, emergencies, etc., you can provide HIPAA information to help take care of patients. In other situations, if there's any legal proceedings, like a subpoena in the judicial or administrative side of things, you can give information up to what is allowed in that subpoena. Certain disclosures to law enforcement, if someone comes in with a fake prescription. Serious threats to health and safety. If someone's threatening to kill themselves, you should be giving up some HIPAA information to protect that patient. And then essential government functions, workers' comp, and the expedited partner therapy, or EPT, in the state of Wisconsin. This covers STD, STIs treatment, and the prescription will not actually have the name of the patient it's going to necessarily all the time. It may just say partner. And the person picking up the medication should also be consulted on their partner's therapy as well as their own therapy. So that's a really big thing. And then I also just included this slide here just to kind of help reinforce the information of what's the difference between HIPAA and FERPA. Reminder, HIPAA is what we in the healthcare system are focusing on, where FERPA is more for the student education records. So thank you, and please see the companion questions for further practice.